What if I told you the reason breastfeeding still hurts has nothing to do with your technique, your supply, or your baby being difficult? What if the problem isn't behavioral at all? What if it's physics? Stay with me for a moment. This might change everything. You're 3 weeks postpartum, you've seen 2 lactation consultants, you've tried every position, watched every video on latch, but nursing still hurts, your baby still clicks, they're frustrated, you're frustrated, and you're starting to wonder if maybe you're just not cut out for this. Let me stop you right there. I believe you tried everything, and I believe something isn't working. Here's what I need you to hear. This isn't about your effort. This isn't about doing more. You're not failing. Your baby's not being difficult. What looks like a breastfeeding problem might actually be a body problem. Hey everyone, I'm Dr. Bryant Harris, certified pediatric chiropractor here in Annapolis, Maryland. I specialize in neurologically-focused chiropractic care for newborns and nursing families. And I see families exactly like yours every single week. Today, I'm going to show you what's really happening in your baby's body and why addressing it could transform your entire breastfeeding journey. Here's what most people, even most healthcare providers, don't fully understand about breastfeeding. For your baby to nurse effectively, they need 3 things working together perfectly. 1, proper movement in their jaw, their neck, and their cranium. 2, a coordinated tongue function for suck, swallow, and breathing, all at the same time. And 3, a nervous system calm and organized enough to do all of this without getting overwhelmed. Now, here's where it gets interesting. Birth, even a beautiful, uncomplicated vaginal delivery, places enormous force on your baby's head, neck, and jaw. We're talking about 60 to 90 pounds of pressure, even more so with a vacuum extraction, forceps, or a C-section. Your baby's head is designed to mold and flex through the birth canal. But here's the thing no one really tells you. That doesn't mean it always returns to perfect alignment afterwards. Think about that for a second. Your baby just went through one of the most physically demanding experiences of their life, and now we're asking them to coordinate the most complex feeding mechanism in the entire animal kingdom. Is it any wonder why some babies struggle? So where exactly does this tension show up? Let me break down the 3 critical areas. The upper cervical spine. This is the very top of your baby's neck. It controls their ability to turn their head, extend their neck, and position themselves at the breast. If the restrictions here, your baby might strongly prefer one breast, they might struggle to tilt their head back for a deep latch, they might seem uncomfortable in certain positions. Next, the cranial bones, specifically the temporal bones that house the jaw joint and the bones that form the roof of the mouth. These affect how wide your baby can open their mouth and how their tongue moves. If these bones may have shifted during birth and didn't fully reset, you might see a shallow latch, clicking sounds, difficult creating suction. And lastly, the nervous system, particularly the vagus nerve. This nerve exits right at the base of the skull and controls the entire suck, swallow, breathe reflex. If your baby's nervous system is stuck in a stressed, dysregulated state from birth, they physically cannot stay calm and organized long enough to feed effectively. Here's this key insight. These aren't behavioral issues. They aren't things you can fix with better positioning or more patience. These are biomechanical and neurological restrictions that need to be addressed in your baby's actual body. What does addressing this actually look like? Let me walk you through exactly what happened. As a neurologically focused chiropractor trained in craniopathy, I use gentle, specific techniques to release tension and restore proper function. Let me be very clear about what this looks like, because I know what you might be picturing, and this isn't that. I'm using the same amount of pressure you'd use to gently check a tomato for ripeness. Sometimes even a bit less. We're not cracking bones. We're not forcing anything. We're using incredibly gentle, specific contacts to release fascial restrictions, restore cranial bone mobility, and calm the nervous system. Here's what I assess. The occiput, which is the base of the skull, where birth trauma often creates the most tension where the vagus nerve exits. Then the atlas and the axis, those are the 2 top bones at the top of the neck, which control rotation and extension, both absolutely critical for latching. Next, the temporal bones, sphenoid and maxilla, which affect palate shape and tongue mobility, and the overall cranial rhythm, which tells me how well your baby's nervous system is regulated. So what actually happens when we address these restrictions? Let me tell you what I see. Often within just a few adjustments, babies who couldn't turn their head to one side suddenly can. Babies who couldn't open their mouth wide enough start getting deeper latches. The clicking stops. Tongue function improves. Fussiness at the breast decreases, and the entire nervous system becomes more regulated, which means your baby can stay calm and organized long enough to actually feed. Moms tell me things like, he's finally able to nurse on the left side. She's not arching anymore. Feeding doesn't hurt. He's actually gaining weight now. But here's something important I want you to understand. This isn't about me fixing your baby. This is about removing the barriers that are preventing preventing their body from doing what it was designed to do. When we release the tension in the upper cervical spine, the cranium, and the jaw, when we calm that nervous system down, your body remembers how to feed because they were born knowing how. They just need the physical and neurological freedom to do it. I want to be honest with you about something extremely important. I don't work alone, and I don't claim to have all the answers. In my practice, I work alongside international board-certified lactation consultants, feeding therapists, pediatric dentists who evaluate for tongue and lip ties, because sometimes there are structural restrictions like ties that also need to be addressed. The best outcomes happen when we work together as a team. When your IBCLC helps with positioning and milk transfer, and I address the biomechanical restrictions, when your pediatric dentist releases a tongue tie, and I help your baby's body adapt and learn to use their new mobility in their body. This isn't an either or. It's a both and you deserve a full team supporting you and your baby. How do you know if your baby might benefit from this kind of care? Here are the signs. I look for difficult latching or constantly sliding off the breast, clicking, smacking, or gulping sounds while nursing, sessions that last 45 minutes or longer, inadequate weight gain despite frequent feedings, strong preference for one breast over the other, head turning preference, meaning they always look one direction more easily, excessive fussiness, arching or crying at the breast, painful nursing for you even when positioning looks correct. These are clues that your baby's body might have restrictions from birth that are interfering with their ability to feed comfortably and effectively. Before I tell you how to take the next steps, I need you to hear something. You don't have to keep struggling. You don't have to keep thinking, this is just how breastfeeding is for me. You don't have to feel guilty for wanting to be easier. You can get clear answers about what's happening in your baby's body, and you can get gentle, effective support that addresses the root cause, not just something that manages the symptoms. You've already proven how much you love your baby by seeking answers, by watching this video, by refusing to accept just keep trying as the only next option. That's not giving up. That's being a fierce advocate for your family. Here's what I want you to do now. If you're local to Annapolis, we offer complimentary consultations where we can talk about what you're experiencing. I can assess your baby's biomechanics, cranial function, and nerve system regulation. And when we explore whether this approach might actually help, there's no pressure, no judgment, just real conversation about your real situation. We also host a free breastfeeding support group every Tuesday from 10 a.m. to 11:30 a.m. where our international board certified lactation consultants provide hands-on support. You don't need to sign up, just show up because you deserve support, real support that sees the whole picture. Visit TruCentered.com or call us at 443-333-9876 to book your complimentary consultation. And if you found this helpful, I'd love it for you to hit the subscribe button. I'm putting out content every week to help families like yours navigate these challenges with real answers. You and your baby are worth it. I'll see you in the next one.